This conference will
hospital
now be
materials.
recorded.
As the prior slide said, this is your forum, and so in today's meeting, what we will be doing is presenting to you a lot of information about your relationship with the hospital, trying to make sure that you're aware of all of any schedule changes at our satellite offices, new programs that we're offering in services, and again, just things that you would normally receive during an interaction with your physician liaison. We do encourage you to engage throughout with your questions. Please use the chat function for that, and that would be terrific. Very quickly, we're going to go over our team members. You've already met me. My name is John Swalai, and I'd also like to introduce Paula Nowak. Paula is our Manager of Physician Services, who also has a territory in the city and to the south. Julie Kalkbrenner is the liaison for our west and northwestern suburban regions. And Chad Worley, the newest member of our team, is covering City North, and the Northwest suburban region. So let's take a look at our agenda really quickly for today. We're going to be going through a presentation on the digital front door, which I'll introduce in a moment. Hospital and physician updates will be coming to you from Julie and Paula. Chad is just going to share with you our new virtual meeting platform that we'll be using with all of you as we visit your practices virtually. Some updates on our satellite schedules and some exciting news about the opening of our new Skokie Center. And then a quick plug for our technology, Epicure Link, and just reaffirming our diversity statement for all of those who seek care at Lurie Children's. So without further ado, I would like to introduce Dr. Ravi Patel. Ravi is our Senior Director of our Digital Front Door and is going to speak with us today on some strategies and planning centered around improving the patient experience using all of our digital tools to assist patients with their relationship with Lurie Children's and also benefiting the practices that we share in the care of kids with. So without further delay, Ravi, can you take it away? Ravi, I'm not sure if you are muted. We are unable to hear you, Dr. Patel, if you're speaking.
Okay. While we wait for Dr. Patel, why don't we move over to Julie Kalkbrenner for her presentation?
Sure. Thank you all for joining us today. I have just a few things I wanted to touch upon that Lurie Children's has recently deployed for our community providers. The first one, hopefully most of you are aware of this, but it's the Lurie MD phone line. This is a fairly new phone line, and this is our 24/7 physician-to-physician consultation line. So this is taking the place of the VIP hotline, in case any of you may remember that or may have used it in the past. 1-855 MD is going to offer a similar service, but this actually will get your provider in touch with a Lurie provider either within 30 minutes or by the end of the business day, whichever is more convenient for your patient situation. So this is up and running, and we hope that you have tried it, especially right now during the pandemic time. If you have any questions regarding a patient that may come through your door regarding their symptoms or something, if they need further action, this is a great time to reach our infectious disease or any of our other specialties at Lurie. And kind of speaking with COVID, COVID has brought a very different way of practice for just about everybody here. One of the things that we have really expanded on at Lurie Children's is our telemedicine program. So we have been thinking about this for a long time, and the pandemic really just forced us to move forward with it. And we're very excited we've been able to offer it with just about every specialty at Lurie. but we're using telemedicine for a variety of different ways with our patients, whether it's better management of chronic conditions that the patients are experiencing, whether it's a specialist consultation either with the family or with the referring provider. And also follow-up visits are a great way for us to keep in touch with patients that were recently hospitalized or had a visit to our ED. One of the other things that's been very helpful with telemedicine is remote patient monitoring. So those are all ways where we're actively using telemedicine right now. Some of the specialties that use it pretty frequently include emergency medicine, our neurocritical care. This is in particular more with our partner hospitals, infectious disease, psychiatry, and ENT. And lastly, one of the other new initiatives that we are expanding on at Lurie Children's is the school nursing program. We had kind of a template set up with our Healthy Communities initiative in the areas of need in the city, and we're looking to expand our school nurse resources to our school nurses. We're going to start with online offerings, whether it's for education or information. Some of the areas of interest will include food allergy, asthma management, behavioral and mental health, and also diabetes management, all in the school setting. So we are excited to roll those out. And I'll roll it over to Paula for some new physicians that have joined Lurie Children's as well.
Paula, you need to unmute. Paula, you need to unmute. There you go.
Yes. And we have 4 new division heads. First in ophthalmology, Brenda Bonsack. Dr. Bonsack arrived in August from University of Michigan. Her special interests include congenital eye disease and childhood glaucoma. And in the division of ophthalmology, we now have 5 ophthalmologists, and there's plans to hire 1 more. In addition to that, we have 2 pediatric optometrists, Dr. Steck, who's at Westchester and Northbrook, and Dr. Shake, who is in New Lenox, and they help to enhance our access. So I want to make you aware of them. They do vision testing, and they see many of the things that our ophthalmologists see. And then if they are not able to manage it, they will get them into an ophthalmologist more quickly. And at Clark and Deming, our ophthalmology department is seeing patients 5 days a week. They also have an urgent add-on clinic the same day. And this clinic is run by residents and fellows with an attending present. In addition, they're doing some visits by telemedicine, mostly post-op and then external eye problems like injuries, for example. Over on the right, you see Dr. Sanjay Kaushal, our new cardiovascular thoracic surgeon. He'll be arriving November 2nd. Dr. Joe Forbes has decided to explore other opportunities and is not at Lurie any longer. Dr. Kaushal has been at Johns Hopkins for 9 years and again is returning to Lurie from previous work here. He focuses on complex neonatal cardiac surgery and heart transplant and is doing research in stem cell trials for hypoplastic left heart syndrome. And Dr. Michael Manji and Dr. Osama El-Tayyib are also part of our cardiovascular thoracic surgery team. New in neurosurgery is Dr. Sandy Lamb, who came in June. Her special interests include cerebrovascular, epilepsy, and craniofacial surgeries. She's focusing on minimally invasive and endoscopic procedures, and also on improving access and expanding our reach through telemedicine. So she can do, and our neurosurgeons can do virtual appointments. Having a nurse in the room, for example, at one of our satellites, and the neurosurgeon in a remote location. They can do their exams and carry out appointments that way. So that should help our access tremendously and help us to reach out further to patients living farther away. And Dr. Lamb is personally seeing patients urgent, next day, in person, or via telemedicine. I mentioned that she's focusing on minimally invasive surgery, one area being epilepsy. And right on the right hand side of the page, you see Dr. Joyce Wu. She's arrived from UCLA on October 1st and is a national expert on tuberous sclerosis. This is a complex inherited disease that affects the brain, heart, kidney, lung, and skin. And it's associated with epilepsy and developmental disorders such as autism. Dr. Wu's research interests are in novel EEG technology, where she looks at detecting biomarkers in childhood epilepsy that would be used to improve epilepsy surgical outcomes. And now I'll move into a few of our other specialists. I'll highlight some of them. As you can see, we're going to be sending you the slides, and you can see that there is going to be a link in orange to each of these specialists so you can look them up in more detail. Over on the right, you can see we have two new endocrinologists, Dr. Bianco and Dr. McCauley. We have another new neurologist, Dr. Omri. We had two neurologists joined us earlier in the year, Dr. Dennis Altman and Dr. Anisa Rahman, and maybe some of your patients have seen them already. And also joining us in genetics, Dr. Joshua Baker. We're so pleased. We know that we have had a shortage in our genetics area. Another developmental and behavioral health specialist, Dr. Anzueto, and then a new ENT, Dr. Saeed Gadersoy. He will be doing surgeries on site at Silver Cross. On the next page, you'll see Dr. Suzanne Nelson, Dr. Wenzel, and Dr. Rundy, three new gastroenterologists. Dr. Nelson has been in private practice and is rejoining Lurie. We also have our new Associate Division Head of Adolescent Medicine, Dr. Greg Montalto, who was at University of Chicago for 25 years, and we're so pleased to have him here. On the right, you see we have three new pulmonologists, Dr. Dang, who specializes in sleep medicine, Dr. Palla and Dr. Dowell, who specialize in cystic fibrosis. And Dr. Dowell also specializes in complex asthma. She's our director of our Lurie CF Center, and she also sees patients in Lenox. We also have a new rheumatologist, Dr. Ravi Patel. We're so pleased. We know, again, this has been a challenging area for access. And Dr. Patel comes to us from Texas Children's, but she actually grew up in our northwest suburbs in Schaumburg. Her special interests include lupus, lupus nephritis, interstitial lung disease, and vasculitis. Earlier in the year, we had another rheumatologist join us, Brian Nolan, and some of you may already have had your patient seen by him. And I think we're ready to move on from our, and I'm going to let Chad pick it up from here.
Okay. Well, thank you, Paula. And hello, everybody. It's been so long since I've seen you all in person. And I got to tell you, I really do miss seeing you all. Working through a computer is so much different than the face-to-face. And it's something I miss doing, as I enjoy it very much. But with that, just like you all have, and everyone at our hospital at Lurie Children's, we're adapting to this pandemic. And like I said, we're so accustomed to seeing you in person, but working through COVID-19 has presented us with really some excellent opportunities to communicate with you. And by the way, anybody can mute if you're not on the phone right now? There's some feedback. Thank you. So, you know, we know you want to hear from us. We know you need the information from us. So we're doing our best to communicate with. And so right now, virtually and through email communication or telephone is really the best way to do it until you're ready to have us back in the office. And one of the things I'd love for you to do is during my presentation right now is try to engage in the chat room and let us know when you feel comfortable with us coming back into your offices, and certain times a day you'd be willing to have some virtual meetings, which leads me into how we're adapting to our new way of working with you, and that is through e-communications. You should have been receiving updates from us about COVID-19 probably since the beginning of April. We've been sending out information to you. Each one of your liaisons, myself, Paula, and Julie, have been sending it out to all of you for information. If you have not been receiving that information, that probably means we don't have the correct email address from you. So if you could contact your liaison, we would love for you to send us the correct email address. Also, you have been getting once a month Lurie-centric updates. And really, that's kind of been taking the place of our coming into the office and saying hello to you. And with these updates, we have been giving you information on new providers, some educational events, but we also been giving you our specialist schedules from our outpatient centers with these updates. So we hope you've been finding those very useful. And we hope it's actually decreased your time of us spending time with us in the office and taking away from your patients. And then you can read this on your free time. And again, I hope that information is very helpful. We've been putting together educational webinars. I know I've been seeing a lot of you or a lot of your physicians on our Wednesday night events and some of our Friday events. So it's been great that you guys have been engaging in that. And of course, this is our virtual practice manager symposium. We're going to get the clunks out. This is our first one. I know it's a little clunky to start, but we're going to get through this. But we hope to do this every quarter, update you on new physicians and other new going-ons with the hospital. And we would love for a continuing engagement with you all. This may be a really great way to keep you guys updated without really bogging down your schedules. So do that. And then the next thing we're going to do is we're going to be doing our virtual specialist visits. We're going to get into here. And so some of you may have already seen this little invitation I sent through our Outlook the other day. And our goal here is to be able to provide you with informational meetings and getting to know our specialists. For instance, here you'll see Dr. Rosenthal. And the reason why I'm presenting her is because we are going to be opening up our new Skokie office in November, and what I'm trying to do is have you get to know who's going to be in Skokie. And so we're going to set up multiple afternoon visits online for you to be able to sit and chat with her and with many of our other physicians about certain issues. She will be speaking on speech and reconnaissance issues in children. And it's not going to just be for the Skokie Northbrook region, but we'll be reaching out all of you, whether it's down south in the city, out west, or up north. We are going to be organizing specialist meetings for all of you because we know how important it is for you to meet with our specialists and get to know them on a regular basis. I had mentioned Skokie earlier, and we're so excited that this is finally going to happen. So on November 23rd, we are opening up all of our services to Skokie except for allergy. And let me go on and tell you a little bit about what we're going to have here at Skokie. And we're going to have allergy, as I mentioned, dermatology, endocrine, gastro, genetics, neurology, peds surgery, sleep medicine, urology. And I'm excited to let you know that we're going to have some wraparound services here too. So, you know, with cardiology, we're going to have echo, and then ortho and sports medicine, we'll have medical imaging and CAS care, and then we're going to have audiology with ENT. So that's pretty exciting. And then we're also going to have full lab services and medical imaging and physical therapy. So we're not going to have OT, but we're going to have all of our services right there in Skokie. It's going to be right off the Edens Expressway, maybe 2 miles east of the Edens on TUI. So very easy to get to, great access. So, and speaking of access, you know, that's one of the reasons we open up Skokie, so we can open up more access for your patients, you and your patients. And then the other thing I'd like to touch on is we're opening up a new site in Glenview. That is where our new gastroenterologists are going to be. Paula touched on Dr. Nelson. So we're very excited about having that as well, opening up more access for you in GI. And then not new, as you know, but one of our oldest partners, Northwest Community Hospital in Arlington Heights. We know that there's a lot going on with them, but I want to assure all of you in that area that we are committed to providing you the best pediatric care as we possibly can. I don't have new information to provide you yet, but when we do have information, we promise to let you know. But again, we are committed to still providing the best pediatric care possible. With that, I'm going to hand it over to Paula again so she can talk to you about some of her area and our new Dayton facility. Mute. Paula, you're on mute.
The Dayton facility has been open for over a year, and we were planning on having an open house in the spring. And so hopefully we'll be able to do that either virtually or in person someday soon. But it's a wonderful facility, and our adolescent outpatient care is there. It's a converted 4-story factory building, and it's decorated in a really cool way for adolescents. And it has our specialty programs like our sex and gender program, HIV, substance use, gynecology, and then also primary care. The adolescent services are offered on the 3rd and 4th floor. And then on the 1st and 2nd floor, we have psychiatry and behavioral health. And you can see the different aspects to those programs on the slide. And I think I mentioned already about Silver Cross, Dr. Goddersoy joining the ENT team to do surgeries down there. It's going to be in January. And we also offer the ortho surgery down there as well, and that will continue. And then there is COVID testing at Silver Cross now in our outpatient center for the pre-procedural testing.
Okay, I can move on to Westchester. We have some news with Westchester. Unfortunately, we are no longer doing sleep studies at our Westchester outpatient facility. We will continue with the sleep clinic visits, the outpatient clinic piece of it, but sleep studies are no longer being done there. And because of that, we have noticed that we do not have as many evening hours available for patients to use our lab. So one of the things that we're asking is that if you have a patient that you do refer to our Westchester lab, or really any of our satellite labs, to just make sure that the patient is aware that we may have some hours that aren't quite as extended as they used to be prior to COVID. Some of our family-friendly evening hours haven't fully resumed quite yet either. So just for any patient looking to come in for a lab draw or a specimen drop off is just encouraged to call the satellite and find out the hours for that particular day. One of the other things I wanted to mention about Lurie and just about all of our outpatient clinics, we have had many of our providers take advantage of an early retirement offering that Lurie Children's was providing to all the employees. So sadly, we had a few of our popular specialists retire in the recent weeks. Dr. Brajunas with developmental pediatrics has retired. Her last day was in September. Dr. Chung with pulmonology also retired then. And one of our popular GI specialists out at CDH, Dr. Malandra, actually left to go practice out of state. So just wanted to prepare all of you that some of our longtime specialists were able to take advantage of early retirement. But we have lots of new ones coming on as well. And that's about a wrap for our satellite specialty updates.
Hi team, it's John. I'm back again. I want to just give a quick plug on our Epicure Link program. Epicure Link is a web-based technology that I know many of you are using. We have an excess of 700 users on this technology. And what it does is it allows you to stay in better touch with any events that are happening for our shared children at Lurie Children's. So, for example, if a child is seen in the ED, for example, you would get an email indicating that you have information in Epicure Link to go take a look, and you would see the progress report from that particular visit. One of the other key capabilities that you've heard us talk about in the past is the request for service order. This provides a very friendly way for us to be able to receive a request for service or a request for consult by completing a form in approximately less than 3 minutes. And once that form is submitted, it actually lands in a scheduler's work queue, and we reach out to the patients to make contact with them and get the appointment scheduled. So there's a convenience there in that the parents are not relying on their memory as to why they're requesting appointments. We get that information from you with the details we need to be able to schedule your patients in the order of medical necessity. And of course, once those appointments are completed, you will be able to then receive those consult reports directly into an inbox, and you'll be notified of that via email. So if you want more information on that, on the prior slide, you will see you can reach out to us at Epicure Link at luriechildrens.org. And if you have any questions, there's another link there with some FAQs to help you along. The last thing that I want to do is let you know that Dr. Patel has not been available to see us this morning. I know he has a young child, so Chad, I'd like to still introduce the plans that Dr. Patel has under his position as the Senior Director of the Digital Front Door. Actually, I just did get a confirmation that, Dr. Patel has been able to join us. So, boy, that was great timing. Ravi, are you out there?
You may
Ravi,
be on.
you are on.
There we go.
Hi, hey guys, can you guys hear me?
Yes, we hear you great. Thank you.
Oh,
Take it away.
I really apologize. I had a family emergency that just came up in the last half hour, so apologies for being late. But John, thanks for teeing it up. For everyone that's on the call, great to meet you all. I recently just joined Lurie as Senior Director of Digital Health. As some context, I joined just over a couple of months ago, and prior to that, I was at McKinsey & Company doing digital health transformation strategies as well as clinical ops strategy. And prior to that, I was a general surgeon by training. And so kind of my passion is how do we actually get care to the patients more effectively and more efficiently, and how can we connect patient service, especially specialty services, to primary care providers more effectively, so that we can streamline some of the process that not only the primary care providers have to go through, but also patients have to go through. And as part of that, in particular, Tom has brought me on specifically to address the digital front door component as well as kind of a global digital strategy. And as we look at the digital front door, some of the things that we're actively working on right now is figuring out how we can serve kind of our evolving patient population. So here's just some statistics for reference, but our patient population is evolving very quickly and more quickly given COVID. But even prior to COVID, 71% of millennials actually expected the ability to self-schedule their medical care online, and more of them even expected a functional personalized web portal, which they defined as not only being able to communicate, but also manage their appointments and ask for quick solutions such as medication refills, paying their bills online, etc. Moreover, there's also the kind of myth out there that some of this technology will actually inhibit the flow or process in some of our clinics. And there's a lot of data out there that has shown significant improvements in terms of reduced no-show rates by 20 to 50% with patient self-scheduling, as well as increased value capture in terms of being able to collect patient-generated information and incorporate that into our notes and really capture the information that we are kind of collecting anyways while we're in person, but not always necessarily documenting. And then there is a transient component of this as we shift from a very heavy phone-based system to a digital communication system. There will be a transition in which there will be more phone calls and messages, and Lurie has prepared itself for that. We've had this discussion with all of our physician leadership across all of the divisions and departments to let them know that we're making this shift and there are set expectations and being able to make this work. And so that'll lead into our next slide. Chad, if you can flip the page. And so all of this is kind of, well, what does this mean for you all and what does this mean for Lurie? Right now, as many of you I'm sure can experience, and I experienced when we moved up here from Houston, it is a very difficult process to get our patients into Lurie because of a very high touch phone-based system. And our goal here is to really transform it into something that is more than just a singular phone-based system that often requires multiple hold times, etc., and create a omni-channel engagement strategy. So not only MyChart kind of being the center of that and leveraging MyChart to its full capabilities and having that portal is crucial, but also interactive websites, incorporating texting, and then also consolidating a lot of what are multiple phone touch points during the phone system, whether it be scheduling, then transferring to the back office for scheduling, or registration as being 3 different people you could potentially touch, consolidating all of that. So we're getting the patient to the right person at the right time so that they can get scheduled and into the slot that they need to get into. And all of this is to really serve to getting patients to develop, to really experience the whole journey and developing that end-to-end functionality. So it's important for us to engage our patients, being able to streamline that process by which they can come into the system, but then also allow digital solutions for them to do many of these kind of administrative tasks, such as registration and appointment scheduling, on their own time, using MyChart as kind of one of their options. And then also that leading into telehealth opportunities and early engagement. And so a crucial piece of this will be, there are some divisions of ours that have very long wait times and access times. A part of this solution will actually be incorporating telehealth so that we can have early engagement. We can triage and effectively engage our patients early on, get some of that testing started, and then have that follow-up appointment in person at a later time to meet the demands, while also recognizing that we have a limited set of physicians and resources and specialists out there for all the services that are needed. If we flip to the next page. I'm not going to spend too much time here, but I mean, we can come back to it if there are questions, but these are just some scenarios in which we could actually transform that experience. So some of it, like I talked about earlier, is kind of a multiple phone call system that's very high touch, streamlining it, singular phone call that can answer all of this. It's also leveraging our patients to provide some of the information that is necessary. So providing their insurance information independently, allowing that registration process to occur. And then one piece that will be, I think, attractive to many of you will also be the idea of open and direct scheduling. And so your patients, especially patients, for those of you who are at Community Connect practices, will be able to see these decision trees, and patients will be able to self-schedule themselves into these divisions. And we're tackling all of our divisions across the entire system so that all of our divisions will be accessible in some fashion through MyChart. Not all of them will be able to go straight to the appointment because some of the complex situations, we actually do want the phone call to happen, but there will be a way for them to at least start the process in MyChart, get a phone call back. We can collect all the appropriate information and then get them seen in the appropriate urgency. And then scenario 4 here is that access to care situation that we were talking about, but it's how do we actually leverage early telehealth opportunities for some of that early engagement, triaging, testing, when we can't necessarily get them into clinic tomorrow. And then the last piece is really kind of for you all to also share with us where there are not only patient feedback, but also on your side, provider feedback on when there's processes, how can we create a real-time service recovery program so that when issues do arise, we are appropriately addressing them in real time rather than kind of months or weeks later. And so if we flip, we can skip this page and flip one more page. And so I want to make this tactical for many of you of what does this actually mean and when are we going to get there, and what this is a vision, but how do we actually make that happen? So for goal 1 right now is, as we look at phase 1, is to really increase our MyChart activation rates. Right now, about a quarter of our patients are on MyChart, which is not sufficient enough of a use case or user population where we can truly engage patients and get them to use all the functionality. There are also pieces that we need to correct in this process. So 2 things are, 1, we are working on updating our customer service system so that our help desk can actually fix most of the problems that patients have in getting into MyChart. And then the second piece is, and this will help not just Lurie, but also all of our Community Connect practices for those of you who are there. And then the second piece is Lurie specific in reducing our response messaging time. So making sure we're addressing these concerns that patients have more appropriately and more quickly. That then leads into phase 2, which is what we're currently preparing to get kicked off starting in January 1st, which is going to be decision trees across all of our divisions. And so we'll be tackling all of our divisions. 11 of them will start in January, and then as some of them wrap up, we'll start finishing the rest of them. We've done 7 so far. We're working on our 8th right now. But to put it in perspective, we'll have about 19 of our 32 divisions done by late spring of 21. And that will drastically increase the ability for our patients to be able to get in for not only just return patients, but specifically what we're targeting is new patients, so that they can come in through MyChart, create their own account, and then create their own appointment, and then be seen in the appropriate clinic by the appropriate provider. And then in later phases, we'll be looking at phase 3 and 4, and this is where we could use some of the feedback from you all of what functionality you would like to see as you partner with us, and what you have heard from patients of what they would like to see and what things we should prioritize. Phase 3 will really be looking at integrating telehealth into the platform, as well as Spanish availability. One of the reasons that we push Spanish availability is purely because we don't want to just translate the app into Spanish, but also have the capacity to answer communications and messages in Spanish, which requires an in-between vendor to translate it for us. And then phase 4 will be another wraparound services, so those educational materials, service recovery programs that we talked about. So I'll pause there. Sorry, I spoke very quickly. But hopefully that makes sense, and I'd love to take questions, feedback, concerns that you guys may have.
I think that's great, Dr. Patel. Thank you. Julie, is there any questions in the chat room? Maybe you can read off real quick. And if not, we would encourage plenty of questions in the chat room that Dr. Patel can help you with.
Sure. Dejo Emil from a pediatric practice in Naperville has asked, in phase 2, will the online scheduling for new PCPs include community PCPs?
Yeah, so we will be working with our Community Connect practices. I don't know, sorry, Dr. Dejo, if you are part of a Community Connect practice or not. But Community Connect practice, sorry, go ahead.
She's not on the Community Connect.
Okay, so unfortunately we only have access to our Epic platforms, and so we will not be doing it for all of the community PCPs, but for community PCPs who are interested in leveraging our Epic platform, they would then be available to use our online scheduling platform.
Is any of this available on Epicure Link at all?
So some of it will be available on Epicure Link. We're still trying to figure out exactly the connections between, especially our specialty cases, and making them available on Epicure Link. So I hope to report back to you at the next quarterly meeting in January on whether or not we get that live. But that is one thing we're actively working on. Literally, I was on a call earlier today on that. So if we can get that going, I think that'll be a crucial component for being able to get the specialty care that patients need.
Okay, hopefully that answered your question, Dejo. We also have another question. Is there a way that practices can be notified when a patient checks in online?
Yeah, so it'll actually show up. We just went live with this last night, and so this will show up in the DAR and the DAR on the left-hand side of the page. And so our PS or patient service representatives or your front desk staff should quickly be able to tell whether or not a patient has done the e-check-in online or not.
Okay, and will that be, in case the practice is not on Community Connect, will the practice be notified through Epicure Link then?
So they won't be able to see it unless we can this is the part of the Epicure Link of where we're trying to be able to share the appointments. So unless we can share right now, only appointments at Community Connect practices and Lurie are visible within my chart. But if we can get Epicure Link to work where we can see all of the other practices, it'll be the same way.
Okay, thank you.
Okay.
Are there any other questions regarding our digital front door? Sounds like for some chronic patients that receive a lot of care at Lurie, if they haven't already signed up for my chart, it sounds like they'll have a lot more availability of services to schedule through my chart coming real soon.
That sounds great. Well, thank you, Dr. Patel. If you can hang on just for a few more minutes, if you don't mind, we're just going to wrap up here. Thank you. We're going to just wrap up here, and then we'll go into the chat room if people wish to participate. So just a little, there's a lot going on in this world, and we just wanted to make sure everyone understands where we're at as far as some of the goings on out in the world right now. And Lurie Children strives to fulfill 3 promises to our patients and community: the promise of a safe space, the promise of a cure, and the promise of a healthier future. To fulfill our promise, we must mindfully engage in dialogues that confront systemic racism. There can be no healthier future as long as there is racism that contributes to disparate health outcomes in our community and in our country. We are committed to combating racism and promoting inclusion so that all members of the Lurie Children's community feel valued, heard, and safe, and that every child can realize the promise of a healthy future. And with that, I just want to, on behalf of our whole team, I just want to thank you for attending today. I encourage you to share your thoughts and discussion in the chat room. But before that, I just want to say we really do miss seeing your faces, and we can't wait to see you again. And please let us know when it's a good time to come and visit you, because we sure do miss you. So with that, I'm going to take off my screen and open up the chat room. If you cannot join us, then I will hope to hear. You'll be seeing an update from us soon with the new schedules, and we'll be talking to you soon.
Team, this is John. One of the things that I think is beneficial in a forum like this is us being able to share some of the things that are keeping us up at night, as well as some of the things that we have discovered that we feel might be of benefit to other practices in the community. So does anyone have a topic that they wish to discuss about any particular challenge and or success that you've had within your practice that you would like to share with your peers? I see that we have a couple of our practices that are doing COVID testing within the office, some rapid tests and some PCR on a case-by-case basis. Is everyone else offering a similar sort of tests within your practice? Any issues in terms of access to testing? Any challenges there? Would love to hear from you. Okay. I am not seeing anything here coming up. We do have, Odijo has let us know that they are doing rapid antigen testing and waiting for their PCR kits following the FDA approval.
And it
Pam
looks
mentioned
like some are unable to get their test yet.
Okay. Okay, we have a question about insurance reimbursement on rapid testing. Does anyone have information about that? If not, let's record that and get back to Dr. Dobkin with the answer, or the team with that answer.
Will do. I'll get back to you, Dr. Dobkin, on that.
Dijo, thank you. Dijo's mentioning that the Blue Cross Blue Shield is reimbursing for rapid antigen tests. Jacqueline, still waiting on Sophia 2 analyzer and test. Currently, we send out to LabCorp with a 2 to 3 day turnaround. Thank you, Mike Molesky from Lake Forest. Blue Cross Blue Shield is reimbursing. UHC has asked for CLIA number to be placed on claims prior to processing. So CLIA number is very important for UHC. Mike, thanks for sharing that with us.
One of the
while we're waiting,
go ahead, John.
Chad.
Well,
I was just going to say, please.
I was just going to mention that earlier in my presentation, I brought up the specialist visits, the virtual ones. If there's certain times of day that work best for your practice, I know in the past we've done midday or lunchtime, because that's usually when you have the best times to do it. But if the evenings work better, or early mornings, let us know, because we want to. This is for you. We're trying to make the best of the situation. So please let us know when are good times for you all.
See, and we do have another question to the group, are how our practice is notifying the health department of positive COVID tests. If any of the practices that are listening have a good suggestion on how to notify the health department, if you could share, that would be wonderful. So it looks like the Illinois Department of Public Health has a system that we're going to get more. Oh, actually, breaking news. Dr. Waskow has responded that Lurie sent an email out about how to report to IDPH of positive tests. So we will look that up. That probably came from one of our Wednesday night meetings, and we can respond to how to go about reporting a positive COVID test to the Department of Health.
Thank you, Dr. Waskow.
Yep.
And Mike Molesky has just offered that IDPH, the INEDSS web portal, is a destination for reporting those tests. Did I get that right, Mike?
Well, thank you, Mike.
Thank you, Mike.
All right. Well, this is.
So, team, I'll just offer one last plug. If you are an Epicure Link user, we do hold our quarterly Epicure Link user group meetings. Our next meeting will be next Tuesday, October 13th, and that will be at noon. So if you have an opportunity to attend that, to either learn more about Epicure Link or benefit from the group discussion and updates about our upcoming quarterly upgrade to the application that will be happening, I believe the 18th of this month. So if you have an opportunity, please join us for that. If you have not received that invitation, please contact us at Epicure Link at luriechildrens.org. Okay, it is 12:56. It looks like the questions are starting to slow down. We are in a position to give you back 4 minutes of your day, but not without expressing our gratitude for your time and attention and participation today. Again, we do, as Chad mentioned, want to hear from you. We would like to shape these meetings in whatever way is beneficial for you so that we can have the appropriate materials to present, the appropriate speakers to share those materials. Again, this is a quarterly forum that we'll be pulling together. I'd like to thank the Physician Services team, Chad, Julie, and Paula, for all of your help in pulling this information together. Dr. Ravi Patel, thank you so much for sharing the exciting news about the coming attractions and improvements related to patient access. We do have one more question before we wrap. How are practices handling patient registrations? Are they having patients e-sign all required documents? Does anyone have any feedback on that question? If you do have any response to that question, feel free to type it in at your leisure into the chat box, and we'll be happy to share that with the other practices. I'm going to ask my Physician Services team if you have any closing comments.
Just want to say thank you to everybody for attending, and we look forward to seeing you all very soon.
Paula?
There are some answers.
Okay. With regard to the reporting of positive COVID tests, Valerie from IDPH can send instructions for registering for a NEDSS account. Once your account is activated, you'll receive follow-up emails with guidance and resources regarding INEDSS. This is Valerie Young. The information is listed in the chat room, and we'll be sure to get that circulated to everyone. Kathy, thank you for your response on the registration question. Kathy shares that she asked the patients to fill these out ahead of time, but because they do not have plexiglass at the front desk and do not feel comfortable taking those forms in person. And I'm not sure if we saw anything else on that. No, I think that's it. All right, folks, it's 12:59, and again, thank you all. We look forward to, please let us know if there's anything we can provide to you. We are here to be your voice and your champion within Lurie Children's Hospital, and we're here to assist you in whatever way possible. We look forward to working with you on our access initiatives as we implement improvements. We're going to be sharing that information with you and invite you to really test those improved processes to make sure that we are meeting the needs of our patients, families, and our providers in the community. So with that, thanks everyone. Have a great day. Stay safe, stay healthy, and if we don't see you before, we'll see you next quarter. Thanks, everybody.